Synthesized in the what is called the thyroglobulin, this pink stuff. If you remember looking at the thyroid gland back in histology, the follicles, the cells themselves, or the follicles are made up of simple cuboidal epithelium, and the pink stuff inside is called thyroglobulin. That is where the hormone is synthesized. It sort of looks like Pepto-Bismol surrounded by simple cuboidal epithelial cells. Again, the secretion and release of thyroid hormone is regulated by a negative feedback. When the thyroid hormone levels get adequate enough, it feeds back to inhibit the release of TRH from the hypothalamus and TSH from the anterior pituitary, and your thyroid levels will drop. Now, overproduction of thyroglobulin can lead to a condition called thyroid goiter. And back in the 20s, it was not unusual to see people on the street with thyroid goiter because of the fact that we didn't have iodine in our salt. And once they realized that iodine was necessary, then it suppressed this. But in South Africa, or in Africa, many of the third world countries in the world, you still see people walking around with thyroid goiter. What happens is that the thyroglobulin just becomes, is produced uncontrollably and will lead to this condition. As far as I know, it is not reversible. There are many other problems associated with thyroid gland. Oversecretion can cause hypertension, tachycardia, anxiety, psychotic reactions, there's a disease called thyrotoxicosis. So it can create tremendous problems. Hyposecretion of thyroid hormone leads to increased obesity, lethargy, and can also cause goiter formation. So the thyroid gland is quite important as far as maintaining normal bodily function. Now, right behind the thyroid gland are 4 to 8 nodules called parathyroid glands. And these structures you can see here on the posterior are just little nodes that reside behind the thyroid. Way back when a person had thyrotoxicosis or was having thyroid problems, they would surgically remove the thyroid gland. And when they removed the thyroid gland, within several weeks after removing it, these people would have tremors, go into convulsions, and several of them died because of lack of a parathyroid gland. That was how they discovered that the parathyroids were quite important to life. The parathyroid gland secretes a hormone called parathyroid hormone, which regulates blood calcium levels. If the calcium levels drop, then the parathyroid hormone releases that hormone, and it acts on bone to activate osteoclasts. It acts on the kidneys to increase the reabsorption of calcium, and acts on the intestines to increase the reabsorption of calcium. And then once the calcium levels come up to their normal level, parathyroid hormone is turned off, and everything is fine. The thyroid gland also produces another hormone called calcitonin. And it doesn't show on here, does it? It's produced by what are called the parafollicular cells right here. So calcitonin is a hormone that comes from the thyroid gland, and it stimulates osteoblasts. So if your calcium levels become high, calcitonin acts on the osteoblasts to increase synthesis of bone. And like the thyroid, again, there is a negative feedback mechanism. This picture shows it very nicely. You can see parathyroid hormone is released into the blood, acts on the bone to break down bone by osteoclasts, acts on the kidneys to increase the absorption or retention of calcium, and acts on the small intestines to increase the absorption. Once those levels get high enough, it feeds back to inhibit release of parathyroid questions on those? Okay, the adrenal glands. Adrenal glands are located above the kidneys. You can see them right here. Some people refer to them as suprarenal glands. There are a pair of them. We talked about them in the sympathetic nervous system. We talked about the central portion of the adrenal gland called the adrenal medulla. The outer layer of the adrenal is called the adrenal cortex, and it is made up of 3 different layers going from top to bottom. It is the zona glomerulosa, zona fasciculata, and zona reticularis. Each layer produces specific hormones. The zona glomerulosa produces what are called mineralocorticoids, in particular aldosterone. Aldosterone is necessary for the retention or excretion of potassium and sodium. The zona fasciculata, which is the thickest zone, produces the corticosteroids. And I think there are about 7 or 8 different corticosteroids. Cortisol is probably the most important. And then the zona reticularis produces the adrenal androgens. And the androgens are hormones which help in sexual development, especially in females, before they pass through puberty. Let's see if I left anything out. Here you can see a cadaver, and here is the adrenal gland right here. And it sits right above the kidney. This is the right kidney right here. Now, excess production of adrenal corticosteroids can lead to a condition called Cushing's disease. This is the same woman on the right as you see on the left. She, for some reason, her adrenals start putting out excess corticosteroids. It creates a real fatty accumulation of fat. The steroids, the adrenal steroids, corticosteroids, are gluconeogenic. They increase the production of glucose, so they can create adrenal diabetes, if you will. If the levels are high for a long period of time, they literally develop a hump of fat on their back called a moon hump, or it's moon face and buffalo hump, I think. I can't remember the name. But at any rate, you can see they have significant problems. It causes flushing of the body and that. This is John F. Kennedy. On the left, it was when he graduated from Harvard. Did you go to Harvard or Yale? At any rate, one of those uppity schools. When he graduated from Harvard, he looked rather gaunt on the left. They later discovered that he had what was called Addison's disease. And Addison's disease is due to a deficiency of aldosterone. Had they not treated it, he would have died younger than what he did. But on the right is a picture of him when he was president, being treated with synthetic aldosterone, and that's why he has more of a puffy face. Also gave him a very tanned look, just the effects of the hormone on the tissue.